In this presentation, I will talk about the tooth simple scaling and polishing procedure, which is also known as the prophy procedure. Guys, I wanted to know that this procedure is indicated for all patients with 1 to 4 millimeter probing depths, which is the normal probing depth, almost normal probing depth. And the prophy procedure or the tooth polishing procedure is summarized in these 4 steps. To do the polishing procedure, you should walk through these 4 steps. Step number 1 is to review the dental and medical histories of the patient with a quick exam for dentition. Here you should concentrate on the if the patient has uncontrolled diabetes mellitus or uncontrolled hypertension, because this will lead to bleeding problems and healing problems. After that, and doing the quick exam to the dentition, you should have known that this patient have 1 to 4 millimeters probing depths and is indicated for the prophy procedure. Step number 2 is to do the scaling or the simple scaling procedure. After the dryness of teeth, you should use the hand scalers, as you can see here in this picture, upper middle picture, or the cavitron, the upper right picture. And that is to remove the supragingival plaque and calculus. After that, you should do the flossing for teeth, and then you check what you have done with the 11-12 probe. As you can see, it's pictured in the lower left corner of uh, this page. And the step number 3 is to do the polishing procedure after this simple scaling procedure, and the polishing procedure is done by using the prophy paste and rubber cup or brush, as you can see here in these lower 2 pictures, the brush, the prophy brush and the prophy cup, which are done by applying a little of the prophy paste or pomace inside the cup and use it, or on the brush and teeth and use it with a slight and short touches, because we don't want to burn the pulp by the overheating of the pulp, by the continuous or long and heavy pressures by using these brushes and rubber cups. Then rinse the tooth with suction. After the completion of this simple scaling and polishing procedure, you should provide the patient with the oral hygiene instructions based on his habits and your findings, and that is by teaching him the correct technique and frequency of the toothbrushing procedure and flossing procedures, and the importance of his oral hygiene that he should put in his mind, then dismiss the patient. That was a summary for the prophy procedure. Thank you for this nanoconstriction of the world by listening to this presentation. Always try to know, always try to spread knowledge and construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.